Hello, everyone. In this video, I will be explaining the influenza virus in a straightforward manner so that those not related to the medical field can understand. In a small village, a boy named Alex was struck by a mysterious fever. Ignoring the chills and relentless cough, he continued to play outside, unaware of the danger lurking within him. Each day, his strength faded, his breaths grew shallow, and darkness clouded his vision. One fateful night, his fever soared to terrifying heights. Alarmed by his delirious state and gasping breaths, his parents rushed him to the village healer. The healer's face grew grave as he examined Alex, recognizing a perilous illness. Days turned into weeks as Alex fought for his life, trapped in a battle against the unseen foe. Through the healer's relentless efforts, Alex finally began to recover. The ordeal left him and his family forever changed, with a profound understanding of the fragility of life and the need to heed the warning signs of mysterious ailments. The history of the influenza virus. Richard Shope discovered the influenza virus in pigs in 1931. A few years later, in 1933, the human influenza virus was isolated by British scientists Wilson Smith, Christopher Andrews, and Patrick Laidlaw. The first flu vaccine was developed in the 1940s. Notable pandemics include Spanish flu, 1918-1919, H1N1, 50 million deaths, Asian flu, 1957-1958, H2N2, 1 to 2 million deaths, Hong Kong flu, 1968-1969, H3N2, 1.4 million deaths, swine flu, 2009-2010, H1N1, 151,700, 575,400 deaths. The death rate varies significantly depending on the strain and healthcare response, with some pandemics having fatality rates of up to 2 to 3%. What is the influenza virus? Influenza, commonly known as the flu, is a contagious illness caused by influenza viruses. Symptoms can range from mild to severe and often include fever, runny nose, sore throat, muscle pain, headache, coughing, fatigue. These symptoms typically appear 1 to 4 days after infection and can last for about 2 to 8 days. In some cases, especially in children, diarrhea and vomiting may also occur. Influenza can lead to complications such as pneumonia, either directly from the virus or due to a bacterial infection that follows. Other serious complications include acute respiratory distress syndrome, ARDS, meningitis, encephalitis, worsening of existing health conditions like asthma or heart disease. Types of influenza. Virus. There are 4 types of influenza viruses: A, B, C, and D. Influenza A virus, IAV, primarily originates from aquatic birds, but can also infect mammals like humans and pigs. It is known for its ability to mutate rapidly, leading to new strains that can cause pandemics. Influenza B virus, IBV, mainly circulates among humans and causes seasonal epidemics. It mutates more slowly than influenza A. Influenza C virus, ICV, also infects humans but typically causes mild respiratory illness, especially in children. It does not cause widespread epidemics like types A and B. Influenza D virus, IDV, found in cattle and pigs. Although it can infect humans, it is not known to cause significant illness in humans. How is it diagnosed? Influenza is diagnosed through a combination of clinical evaluation and laboratory tests. 1. Clinical evaluation. Healthcare providers assess symptoms such as fever, cough, sore throat, and body aches, especially during flu season. They consider exposure to influenza and the prevalence of flu in the community. 2. Laboratory tests. Rapid influenza diagnostic tests, RIDE-TEs. These quick tests detect influenza viral antigens in respiratory specimens, nasal swabs or throat swabs. Results are available within 15 to 30 minutes. Reverse transcription polymerase chain reaction, RT-PCR. This is a more sensitive and specific test that detects influenza viral RNA in respiratory specimens. It can distinguish between influenza types and subtypes and is often used for confirmation. 3. Other diagnostic methods. Viral culture involves growing the influenza virus in specialized laboratory settings, but it is less commonly used due to its longer turnaround time. Serological tests. These may be used to detect antibodies produced by the body in response to influenza infection, but they are typically not used for acute diagnosis. How it is treated. 1. Antiviral medications. Drugs like oseltamivir, Tamiflu, are prescribed early to reduce symptoms and shorten illness duration by inhibiting viral replication. 2. Symptom management. Over-the-counter medications such as acetaminophen or ibuprofen help reduce fever and alleviate pain. Cough suppressants and decongestants may relieve respiratory symptoms. 3. Rest and hydration. Adequate rest supports recovery. Drinking fluids prevents dehydration and helps thin mucus. 4. Prevention of complications. High-risk individuals, such as the elderly or those with underlying health conditions, should monitor symptoms closely and seek medical attention promptly if symptoms worsen. 5. Vaccination. Annual flu vaccines are essential for preventing influenza and reducing its severity if contracted. Thank you for watching. I hope this information has provided you with a clearer understanding of the influenza virus and its implications. If you have any further questions or need additional clarification, please feel free to ask. Your interest in this topic is appreciated.